we have transfer day. What does that actually look like? How long does it take? Can you describe like what the whole setup is?
Typically what happens is we would have you come into the office. Transfer typically happen in the afternoon. Most people have you come in kind of like 30 or 45 minutes before the actual transfer timeline. One important thing that, people have to be ready for is that we do like people to have a partially full bladder on the day of the embryo transfer. And the reason why is because your bladder is in front of your uterus, and when it's full, it tilts the uterus back. So it's easier for us to get catheters into the uterus to transfer the embryo. So most people will come in with like a partial or full bladder. So please don't pee before you come to a transfer, because then we'll just have to wait until your bladder fills up. Get to the transfer, they usually take you back to the transfer room, which is a little bit different for each clinic. Sometimes it's in the operating room, sometimes it's in an ultrasound room, sometimes in a specific transfer room. Typically, again, you get undressed from just the waist down. And then what will happen is usually an ultrasonographer or another MD or a nurse practitioner will check the uterus, meaning that they'll do an abdominal ultrasound, so an ultrasound on the tummy to see kind of what angle is the uterus. And we prefer it to be kind of like at a kind of a 45-degree angle or a little bit flatter, ideally, because it's a little bit easier. If the uterus looks appropriate and it's ready, there is the time that we have you follow up with the embryology team. So they usually come in, identify that this is the embryo that's being placed, talk about its grade, etc. And then again, it depends on the intended parent for the surrogate as well. The reason why is because sometimes intended parents will be in the room with you, and then you should discuss that beforehand. Or sometimes you may be in a different area, so they may want to FaceTime in, or they may not be involved at all on the transfer day. But oftentimes clinics do allow you to have some form of support person if you want them to be with you as well. But again, that's something I think you should discuss, because each clinic is a little bit different about who's going to be actually in the room, because there's not a lot of room in a transfer room, so it can't be like 8 people. Once we're ready for the transfer, you've talked to embryology, intended parents have signed everything, consents have been signed. The doctor who's going to do the transfer places a speculum, and it's just a normal speculum like if you were having a pap smear. Usually the cervix is kind of prepped or cleaned off with soft swabs. Some people use kind of media, etc., depending on their protocol. And then we use little small catheters to get in the uterus. And these catheters are teeny, like the size of like an angel hair pasta noodle. And usually they are kind of thread through the cervix, and they come to just before we would enter the uterus. When you're ready, we know as a physician, we usually tell the lab or the embryologist that we're ready. In my clinic, you can actually see the embryo being pulled up on the screen behind you during the transfer. Then the embryologist brings it in. The catheter is thread through the outer catheter, through the cervix up to the top of the uterus, and then we kind of push a plunger to release the embryo of the uterus. Now, this procedure should not be painful, but the catheter is very, very small, and we're putting in the smallest amount of fluid at the top of the uterus. Most transfers take anywhere between like 5 and 10 minutes. Most of the time, it's quite straightforward. A lot of it's just talking and prep before you actually do the transfer. After the transfer is done, again, each clinic can be a little bit different. Some people may have you lay flat for about 5 or 10 minutes before you're able to go. And then some clinics will allow you just to get up, empty out your bladder, and leave. I mean, they have done studies. There really is actually no difference between laying flat for, 5, 10, 15, 30 minutes and getting right up. However, clinics are very particular, if we will. So you may have a different protocol in terms of what you do after your embryo transfer, depending on the clinic.
So, yeah, I was going to say, depending on the clinic, I mean, we've had, including myself, I've laid there for 5-10 minutes or whatever, and you can get up and go about your day. I'm just taking it easy, obviously, for the day. And then some clinics require you to be on full bed rest for the day, or sometimes even 2 days. And obviously, you said that is clinic-based, but why is that so different, though?
I mean, well, if you think about the history of IVF in general, the first IVF pregnancy, I believe she laid flat for like 2 weeks.
Woo!
And so no one's going to do that. So we've gotten better in the lab, better in terms of creating embryos, culture embryos from day 3 to day now 5, 6, and 7. So for the most part, the thought is that could it potentially disrupt the embryo? But again, they have actually looked at numbers and studies, and there's really no difference. And I have to be completely honest, as a clinic, it's really hard to change something if you're doing really well. This difference is just based on the clinic's preference. Again, I don't think it's going to hurt you whether you lay flat for 10 or 15 minutes or get up right afterwards. But again, the taking it easy part as well. They look in studies and there wasn't really a big difference. And it's just the clinic's preference because, again, everyone has their own data internally, so they just don't want to change it, unfortunately. So you need to be very clear. So like, what are my requirements? And just, again, hopefully follow them because that just makes everyone feel comfortable.